Long time no see.
I know, it's been a while. So great to see you back in town.
I know we're all grown up now.
I know.
So how do we know each other?
So that's a good question. I would say back at MSU, through the uh, Indian Cultural Organization,
Right.
our paths crossed, and
Yeah.
we had some good times back then.
Oh yeah, exactly. So yeah, we're like friends from back in the day, and here we are now. With fast forward 15 years later.
Yeah, at least.
Just aged ourselves.
Yeah, I know. It's been a while.
So tell me what you're up to now.
Yeah, absolutely. So now I'm proud to say I have my own practice here in Bloomfield Hills, Michigan, called Grover Health and Aesthetics, which is the home of Aesthetica, which is our med spa, as well as Grover Health and Wellness. And so Aesthetica is our non-surgical rejuvenation med spa that helps patients achieve their best results using things like injectables, chemical peels, laser skin care, skin products, things of that sort. And then Grover Health and Wellness is our integrative and functional medicine practice, which I have other individuals in the practice as well that help with that. And that is a practice that helps to look at the root cause of why people have certain conditions like, let's say, diabetes or ulcerative colitis or inflammatory bowel disease or hormonal issues or even mental health issues, and helping to figure out what is the root cause of that issue, why the function of their bodies or minds and spirits is not where they want it to be, and how to use the best therapies and integrate that into a plan that helps them lead their best life that they can and enjoy whatever life has to offer them. And so by combining Aesthetica and Grover Health and Wellness into Grover Health and Aesthetics, we're really able to provide our patients with a kind of a 360 experience to experience the best longevity and day-to-day life that they can. Yeah, that's what we do.
That's really great, because I think a lot of consumers, and we can touch on what I'm doing, but just the world that I come from, I don't think a lot of people understand or connect the dot between, if your inside is not good, the outside is not going to look good. Correct. So I think people are like focusing like more individually on like, oh, my inside needs to be fixed separately. Then they're going to the gym. Then they're doing like beauty regimens and then aesthetics. Yeah. But it all has to be kind of married together for it to like really, really like show results.
100%. And that's the one thing that, even for example, yesterday we had a young lady who was 24 years old. She came into us because she had some dermatitis issues, she had some acne issues, rosacea, as well as constipation and some history of gut health issues, as well as some history of hormonal issues. And she came to us not with the idea of, hey, what laser can I get done, or what chemical peel can I get done, or can you just give me a cream for this? She wanted to really do a deep dive into figuring out why things weren't working out. We did discuss kind of more from a topical perspective what could be done, and even from a laser perspective how we can help her from the outside. But a large part of our concentration for her care is actually going to be internally, to help figure out why her gut isn't working correctly and help her gut health function better. And hopefully that will help her skin health show that as well.
Of course. Yeah, that makes sense. I think, from my perspective, my background, obviously you went to med school after college, and I started working. So I went to, my consumer hub, worked at P&G, then I moved over to the beauty world.
Correct. Yeah.
So I worked at L'Oreal, touched brands like Kiehl's, SkinCeuticals, worked at Chanel, then Estee Lauder and L'Oreal. Between them, they kind of own like the whole beauty world.
Correct. Yeah.
So there's so much learning from that side. And most recently, when I launched Jennifer Lopez and Ellen DeGeneres, it was like quite eye-opening for me, because just from a consumer point of view, even me as a consumer, like before we would never think about the effects of like, okay, why do I have constant acne breakouts? Why do I have rosacea? Why do I even have psoriasis? And like, what is the root cause? Because a lot of times, even when I would go to an esthetician or even a doctor, I'm like, hey, put the Band-Aid on this. Like, I need a facial because I'm going to this vacation. So like fix my blemishes or whatever acne that, I have on my face. But never would we say, why is it happening? And why is it happening so consistently? But I think now the consumer is getting more educated with social media, and I think with like doctors like yourself and like maybe brands like myself, where it has to be like a combination of like fix your inside, fix your gut. And I think from Ayurveda, we know that a lot of the issues that start with your gut.
100%.
So I think that's something that I think we should discuss and talk about why people don't focus on that.
So I think that the inside is both a beautiful and a messy place.
Messy for sure.
And I think a lot of times people are afraid to turn inwards because they know that it's a lot of work.
Yeah.
And if you even look at, Ayurveda and yoga and the concept of turning inwards and spending time within yourself by doing things like meditation, deep breathing, and more mind-body work, you're getting to know yourself. You're getting
Absolutely.
to know, and not like your personality as Lekha, Vyas, or myself as Keshav Grover. It's getting to know the creation inside of you.
Mm-hmm.
And if you can understand the creation inside of you is very similar or the same as the creation inside of you and me, the same kind of creator is there, then we can have a much deeper understanding of why things aren't working. And that goes even to what the work is required to be done to achieve, let's say, optimal gut health.
Mm-hmm.
And that does take some work to do in order to put the right lifestyle regimens into play where people are understanding what foods to eat to improve and optimize themselves, how to be hydrated properly, how to focus on their sleep, how to downregulate stress, or what I like to call just get rid of it. Why keep it around and manage it? Just kind of get rid of it if you can. And so I know that's easier said than done. And one other thing is that oftentimes people have had a lot of trauma that hasn't been dealt with. And that's why I think a lot of times people are looking for the quick fixes because they're not willing to take a pause and to really kind of, it's almost like that junk drawer that we all have at home.
Mm-hmm.
That if you really think about it, why is it there?
Yeah.
And so but it's just easier to throw that stuff in that junk drawer and close it and not worry about it or say I'll deal with this later.
Absolutely.
That's a lot of what, like, even going back to using gut health as the example, like if you haven't figured out that, okay, I need to be eating these foods and I need to be drinking these kinds of beverages or avoiding these kinds of things that I'm taking into my body, concentrating on sleep, concentrating on connecting with my community,
Mm-hmm.
concentrating on perhaps the right supplementation for you of certain supplements that may be appropriate. So there's a whole integrated approach that we take here to really figure out why the problem is there and then how to get out of it.
Yeah.
Even if it's a quote unquote shitty situation, no pun intended.
Mm-hmm.
But and so that's kind of what we do here, and we've seen really good success with those willing to do the work.
Yeah.
Because we do get individuals that do come to us thinking that we can kind of make their problems go away with an hour consultation, and that's actually the beginning of the process. That where the work really starts after that 1 hour or 90-minute consult is done, then the actual work starts.
Yeah.
And we aren't the heroes here at all. It's our patients. The patients themselves, they're the ones that are the heroes. They're the ones that are going out there and doing the work. We're just the coach out there guiding them along, rooting for them, telling them what plays to play, how to play those plays, and when to play the play and when to pass the ball and things like that. But they're the ones out there on the field or the court doing the work. And so, and even if that's, using things like Elvy, which is your brand, to help them along the way, then we do that, you know. So that's something that I think is very important in our industry to recognize. How do we give the best combination of tools to our patient to succeed?
Yeah. Got it.
Yeah.
Okay, so the next question I think we should move into is the men's health piece. And then so I don't know how do we bridge the gap. So men's health is one thing we want to touch on. Actually, no, I think that'll be a good segue from, if you ask me, so why did you get into male focused brand?
Yeah.
Why didn't you just do just female focused? Because that's something that you have worked in. And then I can talk about mental health, men's health, why don't we talk about it, and then it's an ignored market.
Yeah.
Okay.
So, Lekha, it's very nice to see that you have your own skincare brand now, Elvy. Tell us about it and, the origins and, how you took kind of a pivot from being in a quite female oriented or dominated market to now a male market.
Yeah. So I know you touched a little bit on mental health, right? I think one area that has been super neglected in this country and even globally is that men are supposed to be so macho, they're supposed to be tough, and they cannot have emotions, they cannot cry. So what people don't realize that this country has the highest rate of male suicide. So like when you look at total population of America, the most people that kill themselves are males.
Mm-hmm.
And that is never discussed. I actually did experience that in my family and my close friends, and also I think that was at teenage, right, in your like very formative years. These boys were probably getting bullied. They have self-esteem issues, and whether it was internal or external, like we still don't know that. But the more I see the younger generation at this point, the Gen Z, the culture has become so superficial, and the bullying has become so immense and normalized. Even I think when we were younger, we didn't have that level of bullying. There was a moral compass, but I think it has shifted now with the younger generation, and I think there needs to be a bigger focus on making sure that men are also allowed to take care of themselves and look and feel good, because that's the only way we can address this whole like the suicide piece, the mental health awareness. Like we're seeing females who are coming out stronger, right? They're in academics, they're athletes, they're as equal to men as, you know, that didn't happen before, and now our males are just kind of like falling behind. So I think it's time, you know, from culture standpoint, and I think just to like take care of the population and steer them in the right direction to allow them to find avenues where they're able to look and feel good.
100%.
So that's definitely like our key focus as we're building the brand. Like it has to be internal, so like focus on your gym, your mental health, your gut health, and also on the outside, because without that, you cannot look and feel good on the outside.
And you know, one thing that I will say is that for the men especially, that the more we actually get used to being a skincare regimen, even if that's using 1 or 2 or 3 products, or in your case 4 products, which I think is a great number, less than a handful.
Yeah,
so,
less than a handful.
Yeah. That I think that when you are in the habit of at least taking a look at yourself in the mirror, and applying a certain level of a regimen on yourself to take care of your skin, you start then to be able to take a little bit more of a look at yourself.
Yeah.
And you're literally taking a look at yourself in the mirror, and I think that helps you also evaluate where you are in life, where you may want to go in life, how do you get there, what are the steps to take. And I think that skincare, even just like, you know, with this with the example that I gave, the person who came to see us just yesterday, the skin's telling us something, you know.
Exactly.
And when you see a friend or a family member that may not have had a great night's sleep or whatnot, they may have the puffy eyes, they may look like, you know, where they're like, oh wow, like what happened to you, you know, like where it's a harbinger of what's going on inside of us.
Oh, absolutely.
And the skin doesn't lie. And
I always say your skin tells your age, your stress, and your lifestyle.
I couldn't
especially
agree
your
more.
eyes.
I couldn't agree more. And so I think by investing in skin health with skin care, you're actually becoming more aware of yourself.
Absolutely.
And many times skin can be telling us of various disease processes inside of us. It can be telling us different autoimmune problems. It can be telling us different injuries that may have occurred. And that's why, you know, it's funny because a lot of times dermatologists are called the quote unquote pimple poppers.
Yeah.
I think there was a Seinfeld episode about that. But, you know, at the end of the day, they do help patients with things like skin cancers and other things like that.
There's so much more to it. Yeah.
Exactly. And so I think that skin is the largest organ in our body.
I was just gonna say that. I'm like, it's about time we take care of the largest organ. And most people don't even know that.
Exactly. So. And it's also our first line of defense.
Yeah.
You know, against any kind of, you know, think about it, during the pandemic, we were washing our hands all the time because the virus could get on our hands. We were covering our face. We were putting, you know, all sorts of personal protective equipment on ourselves to protect our skin, because that was and of course our respiratory tract and other areas. But the skin is such a amazing organ that we need to take better care of it. And I think starting with a skincare regimen for both males and females is the best thing to do.
Yeah, I think that's a great starting point. And I think we kept that in mind, right? Like we wanted to make sure that it's simple. So when it comes to men, like females, I can use your entire closet and still be like, oh, I don't have enough cosmetics.
Yeah.
But I think for men, it's just as simple as like you wake up in the morning, you shower, you feel clean right away, right? So it's like, oh, you get the first whiff of like your menthol-based body wash or soap in this case, I guess, because men use bar soap, which I just don't agree with. It just makes you instantly feel clean. Clean means you feel good. Same thing with skincare. Before I even created the line, I wanted to test the market. I asked the guys, the actual consumers, and I asked them, what do you want? What is the main thing that you care about? Are you interested? And a lot of them said, I'm very interested, but I don't want to go shop in like a female aisle, or I don't want to shop where like my wife with 3 kids or my neighbors with 3 kids are shopping. So there's a stigma again, like going back to men's mental health. Also, there's that stigma that, oh, we don't want to be feminine, so they don't shop. The second thing is, okay, now I'm stealing things from my wife's closet, but I don't know how to use them. Like I'm just applying SPF, then I apply my toner, like whatever she has, I just want to use all of it, but I don't want to go ask her. That was the second key issue. And the third was that they want something that works, right? They can see instant results and it just makes them instantly feel like, okay, I did something for myself today. So we took those 3 elements and actually built a line. So it is numbered, as you guys can see, and it's 1, 2, 3, 4. So we can't really dumb it down further. Our benchmarks for the product were, all the top skincare lines. So our serum is actually, our entire line is plant-based. We want to make sure like it's not animal cruelty, and like we don't want to test on animals, like we want to keep it clean. And so our cleanser, it has AHA, BHA acid, so you know what that does, and it has some percentage of salicylic acid as well. So men with their problem areas, they have a lot of dryness here because of constant shaving, so you tend to break out more, you have ingrown hair, you have blackheads, but then the T-zone gets greasy because you don't have hair there. And then use the same bar soap, the drying suds, all over your face, so it doesn't really benefit you, and they just go out the door. So we want to make sure we keep the male skin concerns in mind. That's why we created the line. So the cleanser really cleans out your pores. It prevents you from acne breakout, and also has a level of hydration. So my next one is my serum, and I love it. I use it. It's kind of like the SkinCeutical CD Ferulic. So it has your vitamin C, helps with brightening your skin, vitamin E, and ferulic acid, which helps bind all the products and give you the best results. So that is our anti-aging, helps with anti-pollution, brightening your skin, and tightening your skin. So I love that. That's my holy grail. And my number 3 is a moisturizer. So you must have seen, probably your patients come in, and I know you have a percentage of male population that comes in as well. Which is, again, they probably have that stigma that, oh my God, I don't want to be seen. The number 3 is a moisturizer. So what that does is, like, because I mentioned the T-zone greasiness and dryness on the beard area, we have niacinamide and ceramide. So they help with 72 hours of hydration without making your skin oily and greasy.
Great.
And my favorite is the eye cream, right? When we talked about like the attention being on the eyes, like as a female, I could just, have 10 tequila shots last night and still apply makeup and look like nothing ever happened, and we're good.
10.
I think 10 is pushing it.
Still living our college days.
Okay, maybe 2. But it takes a toll on me. I have like eye bags the next day. But guys, especially I saw this in my Zoom era of COVID, I would see these guys and I'm just like, you just literally showed up with your raccoon eyes. You had a rough night. Now I don't know whether it's like partying or it's kids or like stress, but you can't do anything to fix it. And I'm like, buddy, you had a rough night. You should do something about that, right? So it's like you see that constantly, and I think the male population also, as they get older, they're struggling to get jobs because they're competing against a younger demographic, and everything is on camera. So the first thing is a first impression, and when people see you, it's your eyes. So that's why we have the eye cream. That's actually really cool. You could appreciate this.
Well, let's see how that works.
So it's actually a twist top, so it's a lock mechanism, and the packaging is patented, and it has 5 stainless steel rollerballs in it.
So that helps to cool and kind of constrict the puffiness down, right?
Exactly.
Yeah.
The key ingredients are caffeine, ceramides, and revenage. So revenage is a plant-based retinol or.
Perfect. Yeah.
Here.
Actually, I've used this a couple times.
Yeah,
And-
so I think with consistent use, and if you put it in the fridge, especially,
in the
it
fridge.
feels so cool
Okay.
when you
Yeah.
apply it. But
Yeah. This I think is a very under talked about subject in terms of keeping up with. I shouldn't say keeping up, but just the nature of where things are. Where now people are working more on Zoom.
yeah,
They're working more on working from home. And so when you're kind of in this box, you're being kind of evaluated on not just
Your
your
looks.
capabilities and your experience, but looks do make a difference in if you get a job or not, or if you keep
Absolutely.
a job or not. And in fact, I remember we had I want to say he was in his mid 60s or late 60s, gentleman who was working for a company here, and he was let go during the pandemic. And he was applying for a new job in the tech sector, and he came in for some neurotoxin or Botox. And so his concern was that, being on Zoom, he was being evaluated and compared to his younger cohort
absolutely.
that he was kind of competing with. And interestingly, after we treated him, he came back at his follow-up, or I think at his second treatment, and because he liked it so much the first time, and said that he got a job.
Wow.
And so whether or not it was the Botox or not, that I can't 100% confirm, but I think it was more that it brought out the best in him.
Absolutely. I think it's a confidence, right? Again, goes back to the point of like, a lot of times things could be placebo effect, but I think as females, because we're taught to care about vanity so much, for us it's like a big pick me up. Like I can slap on a red lipstick and I'm like, oh, I just feel confident. Men don't have that. So even like doing Botox, sometimes you may not see instant results,
Yeah.
but you know that, hey, I did something to take care of myself. It's
Correct.
self-care. And I think it just boosts people's confidence. And I think that's super important. Again, if we go back to like men's health and mental health and addressing that key issue, especially with the younger generation, I think that's something that needs attention. And I think this is one step in the right direction of like teaching people how to start with self-care and normalize that.
100%. And it's interesting you talked about the red lipstick, because there's an interesting statistic about during the Great Depression, actually. This is now over 100 years ago.
Yeah.
Do you know what the most commonly purchased kind of personal item was?
That red lipstick stain or whatever they
Red
used to use
lipstick.
back then?
Because
No way.
it was the one thing that made women feel better about themselves and about life. So if you look at sales of red lipstick during the 1930s and into the 1940s, it actually increased in sales.
That's interesting.
Because people wanted something to help them feel better.
Yeah.
And some may say that that's being vain, or some may be saying that that's very superficial. But I think that there is something to be said about how you perceive yourself
Absolutely.
when you look in the mirror, and also that in general there is this neuropsychological connection that occurs when you receive praise.
Absolutely.
That you look good, or that somebody acknowledges some effort you put into it. Let's say you're on a transformation journey, whether that's weight gain or weight loss. So it depends on what that person's goal is for that person. Or that's why I call it weight optimization in my office.
Yeah, that's true.
In our center, we don't refer to it as just being a weight loss center, because for some, it's not about losing weight. It's actually about gaining weight.
Yeah.
Getting to where they are more healthy.
Right.
For what their organ system is needing. And so the point I was making is that when you receive acknowledgement of your efforts,
yes,
it makes you feel better.
Oh, yeah.
It makes
100%.
you feel also more motivated to continue making those efforts.
Exactly.
It's almost like when you get a good grade in school, maybe your teacher says good job, or maybe your parents acknowledge it and applaud your efforts, or maybe somebody else does. These are all things that are very important for our longevity. Even if you look at something as simple as sports.
Mm-hmm.
When, at the end of sports, one team will say good game to the other team, even if one won or lost, because at the end of the day, it's more about the fact that people are putting in effort.
Exactly. You recorded progress, right? So
Correct.
That's why we have report cards, like record your progress, and that tells you how well you did from the last time, and that's what keeps us all going.
Yeah.
I think one other superficial piece about our culture that we should touch on, because I think this would be more relatable with the generic population, is the dating culture. When we think about dating apps, like that, I feel like that one thing has become so superficial at this point that it is building a lot of like doubt, self-consciousness in both genders, right? Because I think now, even when, Bumble or Hinge, there is an amount of filter. Now, when you get on Snapchat or Instagram or even Facebook and even Zoom, there are filters. So it is telling you that, hey, the true self that you have today is not good enough for perception. So go change it or evolve it or look better. So instead of using that, I know somehow we need to teach our population to like start taking care of yourself, because filters are not gonna last. It's digital.
Yeah, and it's interesting you bring that up, and because I think a lot of times we live in a very, social media has created this kind of virtual reality.
Yeah.
Where people live in social media.
Mm-hmm.
They don't live in what is called IRL, right?
Mm-hmm.
In real life, because you may know somebody well or know about somebody well because of social media, but then when you see that person, there's almost a sense of it can go beautifully. The person, you can embrace each other, catch up, and that's great. But sometimes, and I've experienced this, where you may come across someone and there is a sense of awkwardness.
Yeah.
Because that person may, and it can go both ways, but it's almost like you know each other better in the social media world.
Oh, absolutely.
Or like being plugged in, kind of like using the Matrix analogy, rather than being in real life.
Mm-hmm.
And I think that getting back to, if you're able to feel your best and look your best, then there's not this sense of I need to just capture the best moments of my life and post it on social media. And because that's what the followers want, or that's what the gram wants, or whatever term you want to use.
Exactly.
Yeah.
I think like for men, this is definitely a big topic of discussion, right? And I think like now I hear podcasts and I see them, and men are complaining, right? Because traditionally their role was just to provide for the family. So like they grew up with the mindset of like, okay, all I have to do is make money. Now things have changed because females are stepping up to the plate. Divorce rate is at an all-time high. And based on the stats, we're raising the single most loneliest population of young males. So people don't want to get married. Females are just not, things are changing. So I know you know that paradigm is so different than it was like even 10 years ago, before social media came along. So what advice would you give our guys? Like, what can they do, from like looking and feeling a perspective? Like, how can they take a step in the right direction?
Sure. And so I think the first thing is that take a look in the mirror. And I say that both literally and figuratively.
Yeah.
And ask yourself, what do you like? Not what you don't like. What do you like, and how do you improve upon what you like? Those are the two questions I would ask. And that goes for the outside and then the inside. And then what is preventing you from liking everything? And then how do we get to the root cause of that? And then once we get to the root cause of it, how do we make sure that we're able to be accountable to put the work into those issues so that we can get to being our best? And the second one is that if you do have an amazing partner in your life, and if they're telling you something, even if you listen to them 10% or 20%, that would be my advice too.
Yeah.
Because your partner in your life is a person that is there as they're in your corner.
Yeah.
They want what's best for you. I mean, it's interesting. A lot of people, and I say this very objectively, and I'm very lucky to have this situation myself. A lot of people will say to me, Dr. Grover, you look very young, when's the last time you did Botox and whatnot? And so, it's interesting because I had the good fortune of meeting my current wife many years ago. And so she instilled using skincare products, whichever ones she was using. She was like, why don't you try this?
Yeah.
And I listened to her because I said, oh, why not?
Yeah.
And that's just my personality. I'm more of a why not kind of person versus a why person.
Yeah.
And so I think that because of the combination of using a basic skincare regimen, nothing fancy, and doing it more consistently to where now it's just part of my regimen, where I don't even think about it. You know, my hands are kind of going to the serums.
It's like
and,
brushing your teeth.
Yeah,
in the morning.
exactly.
Yeah.
It's alongside the same principle. And also being in the integrative and functional medicine space, I am privileged to have the knowledge of what foods I should be eating, and what foods I should avoid, and how to kind of re-engineering my thinking so that I am creating more positivity in my life.
Yeah.
And I think that has helped to reflect in my skin.
Yeah.
Because the skin is kind of the first telltale sign of what's going on, like you were mentioning, if you're stressed, if you're unhealthy. I think there's a third thing that you mentioned as well. Or if you're fatigued or had a rough night.
Yeah.
So to me, I think that getting back to what my advice would be to guys, especially now with, Father's Day coming up, which, I'm also proud to say that, that will be a day for me as a father, that I think it's important that you have to take care of yourself, not just for you, which is the utmost importance, but also for your partner, for if you are a parent, or if you are a sibling, if you have a parent that you may be taking care of.
Yeah.
So the more that you invest in yourself by taking a look in the mirror, the more that there's a ripple effect around you in your community of people that you are involved with. So it's almost, and this is what I tell my patients all the time, when you're on the plane and you're going through the security protocol when you first sit down before you take off, what is one of the first things they say? In the event of emergency, oxygen tanks will be, or masks will fall from above.
Right.
And what's the first thing you do?
You put it on yourself first.
Exactly. Because if you can't breathe yourself, you can't help other people breathe.
Yeah.
So I think that to me is kind of like a very important key element too.
I think one myth that I want you to discuss is that people think, and females actually do think that too. I see a lot of people that are very unhealthy.
Yeah.
I have been that too, but at some point they're like, I don't need to do anything. I don't need to work out. I don't need to take care of my skin. A lot of girls don't even wash their face before they go to bed, and guys are they go to the gym, like just a wash, and then they jump into their beds, and then you're like rolling on that pillow every day, and then you have breakouts, and your skin just looks horrible, patchy, discolored. And people think, I'll just go to a dermatologist, I'll go to an aesthetic doctor, and they will fix my face. What's the truth in that? Because I don't think that works, because that's a temporary band-aid. And that's a myth that, as a doctor, I want you to address.
So it's almost like the example of, somebody saying that, I am, like, I'll eat this unhealthy meal, even though I know I have, like, let's say pre-diabetes or something.
My dad.
And I'll just take a pill, and my A1C or my blood sugar that's looked at over 3 months will be normalized.
Yeah.
Or I had a little extra, maybe I'll work out extra tomorrow.
Yeah.
It's almost a reactive thought process that we live in, and that's really kind of the state of our healthcare system.
Yeah.
If you think about it, where you are kind of reacting to events, you're not proactive in preventing events.
Yeah.
I mean, think about how much savings we would have as a nation in healthcare dollars if even look at the COVID pandemic. And this is not a political discussion at all. It's just as facts. The individuals that suffered the most with COVID were the ones that had metabolic issues, were overweight, had other comorbidities that were more lifestyle oriented. And so, and this is just me saying objective data, not being critical of their lives or being kind of judgmental against them. It's just more being objective. That those that had more issues suffered more when COVID happened. They had more hospital stays, longer ICU stays, requirements of ventilation, etc.
Mm-hmm.
And even post-COVID fatigue, long hauler syndrome, all these other things that we're seeing.
Yeah.
So coming back to your point, the person who's saying, oh, I'm just going to go to a dermatologist, this, that, the other. Well, you know, I mean, if you have good skincare regimen, maybe, and you started doing that in your 20s,
absolutely,
maybe you don't need to have Botox until you're later on. If I should say need, but maybe that's not a conversation that comes up as quickly versus somebody who is kind of abusing their skin, you know, or somebody who's not taking care of their skin. Like, let's say you do have makeup on. Oftentimes the concept is just take a makeup wipe and wipe yourself off before you go to sleep. And we hear about that all the time when we ask patients their what's their skincare regimen. And it is shocking to hear those things, but that is also what they're being told by companies you've worked for in the past, because those are products that are being sold to them. And unfortunately, there is a lot of misinformation out there. So I don't blame them, because they're being fed by the media.
Of course.
They're being fed by big pharma about, like, oh, if you're diabetic or this or that, we can take care of you. Or if you have, you know, a skincare issue, we have a potion or a lotion for it or a wipe for it to take care of it. These are tools which can be used, you know, to a certain degree.
Yeah, but
they're
not
not
preventative.
It's not preventative, and it's not the day-to-day lifestyle solution that needs to be in place. So, getting back to your question, to dispel the myth, you know, it's just like anything. The more effort you put in, even if it's incremental doses on a daily basis, you know, it's almost like if you put in $1 into a savings account that has, you know, interest, the more that's going to grow. It's the same thing with our health. The more effort we put into our health and wellness and our aesthetics on a daily basis, the more we're going to see that grow with interest in the long run.
Absolutely.
Yeah.
All right.
Yeah.
I think we got most of the things covered.
Yeah, that was a